Hey, Helen, thank you so much. I really appreciate the invite today, and thanks again for organizing this. It's a fun ability. We were just talking before we started, just a fun ability for so many of us to attend meetings, in the time of our pandemic. To be able to do this in a virtual way, and so I appreciate the invite. Um, so I will see if I can make my clicker move things here. Perfect. Okay. So let me sort of jump in and give you my I guess experience over the last year as it relates to food safety and COVID-19. And as Helen mentioned, I'm going to talk a little bit about some of the work that we're doing here at NC State and colleagues that I'm working with all throughout the U.S. and the world in this intersection of food safety and COVID-19 and SARS-CoV-2. And the slide that I have here, I really want to. I remember explicitly talking. Helen mentioned that I have a podcast of a couple of podcasts, Food Safety Talk and Risky or Not, with my co-host Don Schaffner, who's going to be on later this afternoon. But Don and I talked quite a bit in February, sort of offline, about this emerging disease and illness that we started seeing discussions about in public health fora coming out of China, and obviously now it's trite to say, but we all know that now as COVID-19. But where I really got involved in the conversations I remember the most were in a lot of what I do on a daily basis pre-pandemic was working with individuals in the food sector on microbiology issues, like many of you in the audience and Helen and many of our colleagues, really working to answer questions about managing listeria in a deli, or encouraging thermometer use by food handlers or food workers in a restaurant, with pathogens that our field as food safety professionals that we're familiar with, that there's this history of decades in some cases in the literature about how the pathogen behaves, how it performs, under what conditions can we kill it, under what conditions can we stall its growth. And the part that I reflect on the most over the last year was how those same individuals that I work with on a daily basis, whether it be in a grocery store, a small independent restaurant, or someone who runs food safety for a large meat and poultry processing plant, questions trickled in about this pathogen, about whether we needed to worry about it in the food safety world. And I'll say that from the first thing that got me involved in this was not commercial food at all, but it was a question that came that caused me to really try to coordinate a scientific panel around this. But it was a question that came from food banks, and it was food banks in the U.S. who were emergency food providers who are getting donations from lots of different places, who somehow had a concern that they would stop food donations coming from, quote, high COVID areas in the U.S. And this really goes back to March, early March of 2020. And so that the person who got me involved really wanted to know, is SARS-CoV-2 foodborne? And if we basically said, and if you say no, then you better give me a whole bunch of data to demonstrate why you're saying no. It can't be, yeah, you don't think so, because we're really talking about hunger and disparity and turning a bunch of food away, and we need to have a strong scientific justification on whether this is foodborne or isn't. And it puts all of us in a really odd position, right? Like, you're in the middle of a pandemic with a new pathogen that none of us have handled or worked with in the past. And around the food world, like literally 3 or 4 papers ever, even in coronaviruses. And so now all of a sudden, the entire food world is sort of saying, okay, what are we doing here? Like, it'll be really bad if this virus is transmitted foodborne. How do we know it is or isn't? Food banks are turning away, these foods. So let's go generate some data. Let's think about what we can find and really like scientifically answer this question. And so I guess fortunately, because the world of food safety and microbiology is really focused on this emerging disease, it was quite easy to convene a panel of about 40 folks from throughout the world to dig as hard as we could to find out whether there was any evidence or indication about foodborne transmission. And we were able to sort of at that time say, yeah, we have no evidence. We don't have anything that even go on. Let's start looking at influenza, other respiratory diseases. Is there evidence that they are transmitted foodborne? And in fact, at that time, there wasn't. And I would say that relatively little in a year has changed in that area. But what happened was we had a lot of questions. So we talked about it on our podcast. And so let's sort of move forward and say, well, what do we know about SARS-CoV-2? And I'll reiterate this very briefly because I think all of us who are here in the audience know about this. We know that person-to-person transmission is number one on our transmission route. I'm very careful with how I approach the question of foodborne transmission because as someone who dabbles in the world of risk, mainly from a risk communication and risk management side of things, but I play in the same sandbox as a lot of risk assessors. I'm very, very careful to not provide absolutes because I think there is a very, 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 very unlikely chance, but a route that you could have some foodborne transmission, that the virus actually does end up on food. I mean, that part I don't think we can argue with, and I'm going to show you some data in a second. It's not surprising to someone who's in our world that if someone is shedding a respiratory virus, that in a food processing plant or a food manufacturing plant or in a restaurant, that those virus particles end up on that food. Whether it can be transmitted is a whole other question, right? So let's assume that it's there. Can it go through and infect? Well, we do know that the most likely chance of infection is, and for serious illnesses, is through the respiratory tract. And the good news for the food world is that we don't aspirate food very much into our respiratory tract. And if we do, this is one of the quotes that I used a lot last year in doing media. If we do that, then we're not eating correctly. Something is wrong. But again, it's a chance, but it's not a very good chance. The other good news about the biology of the virus is that as it makes its way down our esophagus into our gastrointestinal tract, that the environment just isn't good for virus infection and virus survival because of acidity and pH. The things that we all need to keep our eyes on, though, is that we have seen infection sites from SARS-CoV-2 in salivary glands, which is an interesting situation. And we certainly have seen SARS-CoV-2 and other coronaviruses shed in fecal, in stool. And so, we think about our normal foodborne illness route. Okay, well, that's something like, oh, we should keep our eyes on that. And I wanna lay that out there, but also reel it all back in, because we have no epidemiology that shows that food has led to any clusters. And we've got millions and millions of cases now of this virus, with contact tracing in some places much better than others, but we really don't have any indication of like food packaging. I would expect by now, and I think our epidemiology world would expect by now, that we would see actual illnesses being linked to common food if food was a source, similar to what we would see in foodborne illness. So I want to be really careful not to say that there is zero chance, because it's never zero, but it is like 1 in 10 billion, 1 in 100 billion. But I put this, I like to talk to food safety professionals about this, because the consumer world really doesn't talk in risk very much, and they are interested in the 1 in 10 billion chance. So again, I want to make sure that we're really clear in how we talk about this. This, in my estimation, is almost never ever going to happen, but it's still a we never get to zero. All right, so what do we know? Yeah, person-to-person transmission. We see the tens of millions of cases that we see throughout the world right now. They are all this. They are all people in shared air. I think that's probably the best way for us to describe this. Close contact that CDC, the US CDC talks about, within 6 feet for more than 15 minutes. I think we've put a lot of value on that as a descriptor, but there's nothing magic about that. In fact, we have lots of indications of people in short amounts of bursts of time, multiple times over the course of a couple of days, leading to infection. Probably the best example of this was in a prison setting here in the U.S., where no one was together for a total of 15 minutes within 6 feet, but there was over the course of a day of opening doors, closing doors, delivering food, checkpoints, there were multiple people that had short amounts, bursts of time. And the most important thing here is really around face coverings to capture those aerosols and virus particles. So we know that. The other thing that I really want to highlight here that we have really not seen a lot of data around is fomites, or our fomites. And so early on, especially for us in the food world, we were really concerned about high-touch surfaces. This is a picture of a grocery cart, disinfecting lots of places, thinking about how other respiratory viruses are transmitted. And I think as we go forward, it's less and less likely that fomites are a significant source of infection based on the data that's out there. So bringing it back, what's the one thing that I worry about the most? It's people being around other people in food settings. That happens a lot. If it's a restaurant, people are around. If we're at normal situations, people are dining next to each other, they're interacting with servers, staff are together in a kitchen, there's a lot of interaction. So having those physical distancing really, really matters. Having face coverings really, really matters to capture those virus particles. Those are our best pieces of mitigation step. But that being said, there is something about demonstrating hygiene, and I'll let me skip forward and sort of actually I'll come back to this one. Thinking about what it looks like in a food processing plant. This paper came out about 2 weeks ago now, from looking at food production facilities here in the US, environmental sampling. And what I really want to highlight here is that, yes, virus particles do end up in high-touch surfaces. In this case, about 1% of 22,000 environmental samples of high-touch surfaces, non-food contact surfaces, in places where over the course of this paper, 15% of people were diagnosed as asymptomatic for COVID-19. There was virus particle there. In fact, what I want to also come back to is, and as I skip forward and back on my slides here, some work that was released at from colleagues in China looking at environmental sampling in that setting, in food settings as well. And I find this one particularly fascinating. So what was reported, and again, we haven't seen sort of a peer-reviewed journal article on this or a public report to see everything, but I do think that there's value in what we have seen, which was almost 3 million specimens in food environments, in food food packaging as well. And of those almost 3 million specimens, 22 total positive PCR samples. And by positive PCR samples, they'll get a little bit in the weeds here, but really that doesn't even tell us whether it's infectious virus particles. It only tells us that there's viral RNA that's there. So if I take these two data sets, what we have here from China and what I showed you here in U.S. Food manufacturing, I think I can summarize by saying, yes, it's possible. Yes, it's likely that if we go looking for viral RNA in food settings, we will find it. We don't have indication, even in cluster analysis, that finding it in the environment, the environment itself are risk factors. It's really still comes down to what I showed you earlier, people being around other people. So we have to think about, how do we structure our food settings to have people away from other people and continue to do that. I think that that's something that we're certainly going to continue beyond 2021. I think this is something that we're going to battle with for a while, but I do hope that, and I'm going to tell you a little bit about a project here that we're working on right now. But I do hope that I know that we all have limited amounts of resources to address food safety and COVID. And I hope that we are able to place our resources, our COVID resources, towards risk reduction strategies that actually reduce risk. And looking at where we are a year into this, my suggestion is in ventilation, air systems, HEPA filters, MERV filters, and the way and restructuring how we have shared air. And I'm not going to go too far into the details on that, but I think that's where we need to go, and less on disinfection of high touch surfaces, because air and aerosols are certainly the things that we see as the source. Okay, so let me move forward a little bit, and I'll talk about a project that came out of that food bank work that we did a year ago, because we were getting so many questions as outreach and individuals that work in food as microbiologists. We started pulling together resources to say, okay, here's what we know and here's what we don't know. And we were in a really odd situation that I can't say I've experienced before in my career, where our federal agencies and international agencies were not super fast. And I'm not saying that in a bad way to denigrate what they were doing. Is they weren't super fast because there wasn't a lot of information out there, and their system doesn't move super fast. So what we had from international and our federal agencies here in the US was, food is not a source. But what we were missing was, how do we manage SARS-CoV-2 specifically in food environments? What do we do for our meat and poultry processing plants? What do we do at a farmer's market? And so we built a project to start to answer some of those questions. It's called Food CoVNet. We were really lucky to also gather resources from the U.S. federal government as part of a whole bunch of projects that were funded in this area last October to address concerns in the food safety and COVID-19 realm. And so we were, all the work that I'm going to tell you about here was funded by USDA, National Institute of Food and Agriculture. They provided Food CoVNet with $1 million in a 2-year project to investigate a bunch of stuff. So we started putting out a lot of materials, again, as I mentioned, what to do at a farmer's market, what to do in retail settings, what to do at a restaurant, working with our National Restaurant Association on guidelines. And I say this very, I guess, again, very carefully. I don't see at all that anything that we do in the food world is absolute. I can see risks at all restaurants. How it's managed is really the difference. So we're going through a whole, and as everybody is, I think, in the world, we're going through a whole conversation about reopening restaurants and releasing restrictions and relaxing restrictions. And I think we're looking at the sector of restaurants and grocery stores as everything is equal when you walk in there, and it's not. How well mask mandates or mask policies are enforced matters. How well physical and social distancing is enforced matters. Whether it's indoor or outdoor matters. How well air is managed matters. So it's a continuum. And in fact, that's really what we wanted to talk about in all of our material, and what we're focusing on this project is how do you move, just like we do in food safety, how do you move towards risk reduction? Not this is, not, it's a different, title of a podcast I do, but it's not like this is risky and this isn't risky, because that's not how we operate. We operate in how do we move down the line towards further risk reduction. So, we put together a lot of information on this, and then put together a team. And so the project that I'll share with you for 3 or 4 minutes here, called FoodCoveyNet, is really bringing together microbiologists and outreach education professionals throughout the U.S. and the world to fill data gaps. Because where we were a year ago with this emerging pathogen was we don't have data, and we still don't have a whole lot of food-related specific data. We certainly know that the virus can persist longer on stainless steel compared to plastic, compared to cardboard, compared to copper, but those are all in laboratory settings. Let's put all those things into action in a food setting. What do we know? With varying humidity, varying temperatures, varying air situations, to really fill those data gaps, to demonstrate why we're not seeing illnesses and transmission routes through food or through food packaging. So we put together this project. My collaborators, we have collaborators here at NC State, my university, Michelle Daniluk, who many of you probably know through IAFP at the University of Florida as part of our team. Don Schaffner, who's talking later this afternoon at Rutgers University, is also part of our team modeling some of this work, as well as a colleague at the University of Nebraska-Lincoln, Byron Chavez. And there are other individuals, virologists, people who are in the food world, extension and outreach folks, who are all contributing to this. But essentially, our goals in this project are to collect all the data that's out there and that may be adjacent to the food world, and share that with our stakeholders to say, you know what, here's some information about masks that is important for you to know because we're going to be dealing with masks for a while. Here's some information about persistence on fomites that isn't specific to food, but you should know about this. And then taking those data gaps and moving them into the food world in the laboratory. So we're working on right now surrogates, bacteriophage surrogates, mammalian coronavirus surrogates, and then moving towards SARS-CoV-2, but understanding more about transfer hands to surfaces, back to hands, from food packaging to hands, from food to hands, from food to food packaging, all of the things that we've done in so many other foodborne pathogens, trying to actually do that same work with this virus. And this is, where our hypothesis lies, is we believe that it's not really going to persist very well, and it's not going to transfer very well. But right now it's, and I shouldn't say just for us, many groups are looking at this, but it is a bit of a guess right now, and we need data to support this. On top of that, we're doing just a ton of outreach, training, and work with various levels of stakeholders in the food system. So we started a program here in North Carolina focused on restaurants called Count on Me NC. We worked with, this is our first outreach pilot, working with our Department of Health, our tourism board, and our Restaurant and Lodging Association. And the really cool part about this was, for being able to get everybody together to manage a crisis and put something together really quickly as part of this FoodCoveyNet project, to date, we've had almost 16,000 people take online courses who work in restaurants and in other retail businesses just in our state. We're launching this nationally over the next month or so, but just the vast need for this information has been overwhelming. And I've never been part of a project where so many people sought out certification so quickly. And so this is the type of stuff that we're doing with the FoodCoveyNet project. So for more information on that, all of our stuff is at foodcovey.net. kind of convenient that we called it foodcov.net, but that's foodcov.net. And you can find everything that I just talked about there. For the next and last really 3 minutes here, I want to tell you about, that's how everything's changed, right? The title of my talk was How Everything Has Changed. I want to tell you a little bit about how nothing's changed in the world of food safety. And that is, we still have foodborne pathogens. We still have, it's been interesting to sort of follow this. We still deal with outbreaks. We're still dealing with recalls. We still, in the midst of managing COVID, have to manage food safety. And it's I'm sure many of you are living this day in and day out in a way that I am not. Many of the people in food businesses are tasked with managing both of these things now. It's not a new, like, here are the people that are going to focus on COVID, here are the people that are going to focus on food safety. So often it's both the same. And I want to tell you just a little bit of a story about how we're still managing research at NC State around food safety. And I do want to give a shout out to Cardiff Met as part of this, because a lot of inspiration for the research I do on consumer food safety came from a trip that I took to Cardiff in 2006 and stole everyone's ideas that I hung out with there. So I apologize, but those 15 years have been really good to me. So we in fact built kitchens to do consumer behavior work because of the inspiration that I had when I was at Cardiff. We still are running observations with these kitchens. Here are just some pictures of what this looks like. Last year, well, before 2019 to getting into 2020, we did over, really 950 observations of consumer food handling and food handler, commercial food handler, food handling, collected almost 1,000 hours of data. And what hasn't changed is that we're actually still doing that work. And I was telling Helen before, instead of us doing on a really great week, we might do 30 to 35 observations a week. We'll bring in consumers to our kitchens. We'll ask them to prepare meals. We have surrogate bacteria in the foods. It moves around the kitchen. We swab. We're running 3 observations sometimes at a time, because the kitchens I showed you before, we actually have 3 of them that are side by side. Now, because of how we have to manage COVID to protect ourselves and our participants, we're able to do on a great week 10. But we're still doing it. And we started going back into our kitchens back in August to really do this work. The last thing I want to show you, just as a highlight of the types of things that we're doing, is really, one of our projects was focused on poultry washing. And so our projects have been large. We'll bring in 300 to 400 people per project to understand how they're handling food. So we'll watch poultry washers for their specific practices. We understand about how they rinse in the sink, but it's not exactly what we thought it was before. Instead of thinking that someone's going to turn the tap on, rinse this poultry under the running water, that happens 85% of the time. 15% of the time they do something else. But again, this work still needs to be done in the midst of COVID. And what we're doing right now is trying to figure out if hand washing and hygiene has really changed what people are doing. Other things that we see as it relates to this is just like where those surrogates go. And so, this work has all been published, but really understanding that once people do wash poultry, it moves. Understanding that how it ends up in the sink and basin really matters, and how people clean and sanitize really matters. And then finally, where we're going right now with our work is on eye tracking. And so really focused on what happens, what are people seeing, what are they reading on labels, does that impact their behaviors? And again, I want to end with this by saying all this work still needs to go on. We can't forget the world of food safety as we go forward. Anyway, that's last little bit of what you kind of see with eye tracking. With that, I have a question slide, but I don't think we're going to take time for questions now. I'm going to come back for the panel later on. But anyway, with that, thank you very much for inviting me today, and I'll see you all in a couple hours.